You know, one problem that a lot of women deal with when they reach their 30s is fibromyalgia. And Dr. Sonia Spencer with Spencer Chiropractic. How are you?
I'm doing great,
It's good
Jim.
to see you again.
It's
And-
great to see you.
And that's true. I mean, I know men get it, but it's true that it's more so women.
It is mostly women that get fibromyalgia, and it is a very serious problem in our society today. Fibromyalgia is a chronic pain syndrome that women deal with, every single day. And a lot of women take medication daily to deal with this issue.
What causes it?
Well, it's a problem that has no unknown cause, that has an unknown cause.
Right.
They haven't been able to say, this is the cause of fibromyalgia. So they can't just say, well, it's a virus, it's an accident, it's a psychological issue.
It's hereditary.
It's hereditary. None of those factors have been determined. And so it takes literally a village to treat fibromyalgia.
Wow.
A person has to really determine the best course of treatment for themselves. But I'm going to explain to you how chiropractic can help fibromyalgia today and how we can treat someone with fibromyalgia.
What are some of the things that may give you a telltale sign that, okay, I think I may have it?
Okay, well, fibromyalgia is diagnosed by trigger points along the spine, and that's basically, you can diagnose yourself by taking a self-test on the internet.
I think you can test everything on the internet nowadays.
Yeah, so everybody, and unfortunately that's how a lot of diseases are nowadays. You can take the self-test, and so with the development of these trigger points actually correlate to a lot of the trigger points that we can help in chiropractic care, and that's why I want to tell you there is hope if you have trigger points along your body with getting chiropractic care. And I want to show you some of the things that can cause trigger points and tell you what a trigger point is.
Okay.
And explain to you some of the things and what fibro is like a fibrous tissue, and myalgia literally just mean muscle pain. Okay. And so in looking at this little model here, this is an example of a joint, and to the left and to the right here, we are looking at muscles. And this represents a trigger point in the muscle belly. You see how nice and big and swollen this is?
Yeah, yeah.
And this over here,
Looks
you see,
dead.
Yeah. Well, you see how it's kind of all crossed up there? That's where the body has attempted to heal a muscle in a way that has not really been conducive for the body. And on this side, it's representing some scar tissue. So it looks like that this side of the body has been damaged, and this side is inflamed. Okay?
Okay.
So when we are examining the spine, we can actually feel these trigger points over here. And there have actually been studies that the type of therapy we do here in our office, one of the therapies we do called the cold laser therapy, when we do the cold laser therapy over these trigger points, that they lessen and they're relieved with this type of treatment. That's one of the studies that you can find from the National Institutes of Health, which has studied fibromyalgia, that these are relieved with the cold laser therapy that we do right here in our office.
I remember in some of the past segments that we've done here that you've demonstrated the cold laser therapy, and this is like it's just being touched with a little cold wand.
Absolutely, and it's a totally non-invasive therapy that has no negative side effects, and it gets great results for these types of trigger points. So let's explain what it causes some of these trigger points. Now you notice that there's little nerves that are connected here. These little yellow things are nerves, and it's connected to a joint. Now if a joint doesn't move properly over time, it's going to start firing pain signals into this muscle and give a feedback into this joint. In fibromyalgia, I have found from being a chiropractor for the last 13 years that what happens many times in these fibromyalgia patients is that these joints are really locked up and not moving properly. And in fact, they should have a normal motion that they don't have, and they're not moving properly. Now, one thing about fibromyalgia patients is it really hurts them to get a lot of movement. And perhaps sometime in their lifetime that they can remember or either not remember, this part of their spine was damaged. And so we have to very, very gently get some movement in this area. And they're not going to respond well to the typical chiropractic adjustments. So we have to use very, very, very gentle chiropractic adjustments with an instrument, the lightest instrument we have on these areas, to get some movement back into this. And once that happens, the joint will begin to move well. And as we do the cold laser on these trigger points, the body will begin to resorb some of these pain signals that are going into this area. And the result will be a better quality of life for this patient. Will fibromyalgia 100% resolve? No.
That was my
won't.
next question. Is there a cure for it?
There's no cure.
There is relief.
There is relief, and there's better quality of life.
That's
Plus,
the important thing.
as we talked about on earlier segments, if you leave a joint like this, what happens is it deteriorates and the problem can get worse. And medications, a lot of times just treat the symptom without directing any problem to any kind of cause of it and allow a joint to deteriorate. And so in many years later on in life, the patient will actually get worse and then end up on more medications with more serious problems than they realize.
And the medications, they're just masking the issue.
It is just masking the issue, which we understand that patients do need medication, but they also need to address the cause. So this is how chiropractic is different. We address cause, and medications many times just address symptoms. And sometimes both things need to happen simultaneously.
Wow.
So in chiropractic, if we look at the whole person, we need to look at fibromyalgia patients nutritionally. We need to look at, are they in healthy environments, the thoughts you think, the foods you eat, what type of exercise are you getting, all of those things. Water you're drinking. Many people are eating unhealthy diets, consuming foods that are inflammatory. We need to address all that with a fibromyalgia patient.
So put down that double cheeseburger. Thank you, Dr. Spencer.
You're welcome.
If you want some more information about this and like to make an appointment, the number is on your screen. They're located on Pass Road in Gulfport, across from Pass Road Elementary, Spencer Chiropractic.